Today we are showing total all the instrument and the step and whole procedure for the hip replacement cemented. So first, for starting the procedure, we are taking the incision over here and then we are separating the muscles and all the structures nearby that joint. After taking the incision and separating the structures, we just have to take the joint out of the SWM. So for that we can use this distractor. We have different variety of shape of distractor which we can use to separate the bone surface during surgery. Then we can use this for maintain the space in the joint visibility and to assess the alignment. So like this we can use this distractor. Then this is the bone hook to hold that bone correctly in the position and manipulate any soft tissues. We can use this hook, or if you want to lift the bone, you can use this bone hook. Head, we will start the procedure for the femoral stem. For that, the third step will be the measuring the osteotome ruler. This is the osteotome ruler in which we can use the measurement for the bone cut. That's used to check the gap and a distraction and the distance of the leg length and precision planning and for the measuring the bone cut. And after this marking, we can cut the bone from the GT line. This is the awl and it's used to create the starter hole in the bone and initiate the drilling before giving the screw, and this is the entry point which can be used to initiate the nail entry in the femoral canal. And this is the T-handle which we can use and lock this T-handle, and by using this we can use this instrument and take the entry in the femoral canal. This is the osteotome and this is hammer. After taking entry into the femoral canal, we can use this osteotome, and to this osteotome is used to remove the cancellous bone in the femoral canal, in which we can use this hammer to give the extra pressure and prepare the box slot in the proximal femur. This is the entry reamer and this can be used with the T-handle. And after taking the T-handle with the reamer, you can use this to open the medullary canal in the long bones like femur and tibia. At start, you can use this procedure. These are the distal reamer and this can be used with the T-handle by locking this, and then you can use this in the opening of distal canal for femoral bone. After the reaming, we would take the another step forward, that's a trial stem. These all are cemented trial stems like small, medium, large and extra large sizes. This is the femoral trial stem handle. You just have to take the trial stem and then lock the handle. And then we just have to take the trial, and if you want any pressure, you can use the hammer for it, and you can take the trowel for the femoral stem. If you are stuck with the trowel stem, to remove that trowel, then you can use this slotted hammer and hang this on the stem handle, and you can just use this pressure to remove and take out the femoral stem out of the bone. This is the stem extractor. For trial stem, you can use this by locking the trial, and you can just extract the stem by using this extractor. This is the reverse slotted hammer, and this can be used to remove the trial stem also. You can use and lock this. And after locking this, you can use this reverse slotted hammer. This is the neck offset which can be used to trial the internal head with the femoral stem, and we have the marking of C which shows that this neck offset is used for a cemented hip replacement only, because we have total femoral neck is 127. So they just will be aligned in the 127 by locking this cemented C-wise neck offset, and after that you can take the trial to the internal head easily. This is the stem centralizer, and this can be locked in the tip of the stem to keep the stem in the central position. Then this is the cement restrictor, which can be inserted before pouring the cement into the femoral canal. This is the instrument to insert the cement centralizer in the canal. After inserting this, we can remove this. This is the femoral stem handle, and you can lock this handle in the stem, and by this you can insert this stem, femoral stem, and you can use the hammer to give the extra pressure. If you want to anti-version or move the stem on the anterior side, then you can use this Tommy bar. You can lock this, and you can use this by doing the movement for femoral stem. This is the universal adapter, which can be used if someone is not having the same design of the adapter. To link the instrument for the power system, you can use this adapter. This all are the acetabular reamer for the reaming purposes that come for cemented acetabular reaming from 44 to 64. This is the acetabular reaming handle, and this is the T handle, which you can just lock it by using this. After the reaming handle, you can just lock the reaming cup by locking this like this, and you can just do the start procedure for the reaming. This all are the acetabular trial cup, which we can use to take the size for the acetabular cup, and which come from 40 to 62 mm size, and you can just use this handle to take the trial size, and you can just lock this by using this handle. And after this,